How is it going, everybody? Welcome back to TruthMed. I am, as always, Dr. G. For those of you who've seen my videos before, welcome right on back. I do appreciate you being back. I apologize that I haven't put out any videos recently. My last one was on the COVID vaccine, for which, by the way, I really wanted to thank everybody. I got a lot of positive feedback and a lot of comments on that one, and quite a few questions were generated from one source or another. So thank you very much for that. But that's been a while. Got pretty busy with the pandemic in January and February, but that's all calmed down now. Cases are way down, for which I'm very thankful. And so I've got some time to do some videos. So in terms of topics, I'm basically choosing topics based on what I hear in real life, in my personal life, in my professional life. What are the questions that people are asking me? And for example, I've had some questions about the opiate epidemic. So I'm going to do a video about that. I've had a number of guys ask me about testosterone therapy. So I'm going to do a video on that. And I'm looking to do a video on alternative medicine. That's always big. And in particular, the questions I've been receiving lately have been about vitamins and supplements. So I'm going to talk about that. Those are upcoming videos. But the topic for today, as many of you are aware, the CDC about a year ago issued a mandate that said that everyone who is traveling on public transportation has to wear a mask. And that mandate was supposed to expire on April 18th of this year, 2022. But instead of it expiring naturally, instead it was struck down by a federal judge in Florida. How did this happen? What are the reasonings behind it? Is it a good thing? Is it a bad thing? I've had a lot of questions about that over the past few weeks. And so I thought I'd put a video together to answer more of you at the same time rather than going through it with each individual person because it seems to be one of those things that people have a lot of questions about. So we'll get into that. As usual, I want to give you the bottom line up front. So if you're the sort of person who just can't quite sit through a 10-minute video, that's okay. I'll give you my opinion right up front. But if you really want to know the data and the medical research that is behind that opinion, stick around for the rest of the video. But anyway, right up front, the bottom line, do I think it's time for that mandate to go away? Yes, I think it's a reasonable time for that mandate to go away. I think we're at a place where that is okay to do. In fact, I think we probably could have done it a little bit earlier, not too much earlier, because remember, just in January of this year, just a few months ago, we had the highest number of cases that we have had for the entire pandemic. So we weren't ready then, but by March, things had quieted down, so we could possibly have ended it then. And certainly we could on April 18th. So I think it's perfectly fine that the mandate went away. It was going to go away anyway. But the way in which it went away and the reasons, no, that was a disaster. That was bad. And so that's the verdict. And now I'll go into why. So this was a case that was brought before a federal judge by two women, Anna Carolina Daza and Sarah Pope, in conjunction with a Wyoming-based nonprofit group called, I believe, the Health Freedom Defense Fund, which has challenged vaccine and mask mandates in other parts of the country previously. Essentially, they alleged that the CDC's mandate was arbitrary and capricious because it allowed for exemptions for 2-year-olds and younger. They don't have to wear masks, but no exemptions for anyone else. Now, as you look at this on the surface, you think, do they really care about that? Are they really jealous of that 1-year-old over there that doesn't have to wear a mask? Do they really want to be that 1-year-old? I don't think so. They just don't like a mandate, right? They don't like being told what to do. This is America. We don't like being told what to do. And it's true, we don't. And I can certainly empathize with that. But having said that, we also have to have law and order. I mean, does that mean that we should get rid of seatbelts? Does that mean that it's okay for us to sell crack to kindergartners? I mean, you have to have some laws. You have to have some mandates. We don't like it, and we don't like it especially when they're new, but sometimes we have to have them. And the CDC was acting well within its purview to do this, but not so according to Judge Mizell. She actually struck it down for different reasons. There are two reasons specifically. One, she said that it violated the 1944 Health Services Act, which this is where the CDC derives much of its power to do things. It basically allows the CDC to take certain measures to prevent the spread of communicable diseases. It basically allows them to give mask mandates and stuff like that. But the specific wording in the Health Services Act says that they may use sanitation as a measure. And Judge Mizell took a very narrow take on the word sanitation. She said sanitation means making something clean, not keeping something clean, and therefore they don't have the right to say that you have to wear masks. So that's keeping something clean, not making something clean, which when I heard that, I sort of felt like we were back in the days of Bill Clinton when he was all like, that depends on what the definition of the word is. You know, it's getting silly. It's getting very technical. I don't think I agree with her at all on that, nor do I think most healthcare providers would. But she did have another point, which I think holds a little bit more water, or at least it does until you view it in context. And that is that she said that it violated the Administrative Procedures Act, which basically says that the CDC, there needs to be an emergency for the CDC to act. And while you could definitely say that COVID represented an emergency, she pointed out that the CDC didn't put this mandate into effect until like a year into the pandemic. Thus, it clearly wasn't an emergency. Well, I mean, she does have a point there. Why didn't the CDC act more quickly? On the other hand, you could say better late than never, right? But it is true. Why didn't they act earlier? But this is where we unfortunately have to get into politics, which I don't like doing. I don't like it when politics nuzzles its way into medicine, but unfortunately that does happen. We now know from texts and emails that were circulating at the time that have been revealed that the White House was leaning pretty heavily on the CDC at the time to downplay the risk of COVID, to basically say, don't make such a big deal out of it. It's not that big of a deal. Hopefully, it'll just go away on its own. And if you're a cynic and a skeptic, you would say, this is pretty underhanded. This is a political move that is designed to just keep from negatively affecting the president's ratings, right? They want the poll numbers to stay high, and any negative news drops the polls. And that's why they're telling the CDC to shush. But if you're a little kinder, you say that they just don't want the CDC to panic people because panic doesn't hurt anybody. But either way, it neglects the fact that this is something that so many presidents and rulers and senates have forgotten this basic fact, which is what makes people panic more than anything? It's when they perceive that there is a threat and nobody is informing them. You have to inform your public. If you're keeping things under wraps, but they know something's going on, that's when they panic. Just tell them what's going on. And that didn't happen here. The CDC was basically suppressed. It wasn't allowed to tell the full story. So that's why they didn't put this mandate in effect earlier, or at least it's a guess, but that seems to be what the data points to. So basically, yes, the CDC should have acted sooner, but there were reasons why they didn't. Meanwhile, you can definitely say that we are still in a crisis because, again, remember, the biggest peak of cases in the whole pandemic wasn't until just this January 2022. So, and the mandate went into effect well before that. So I think both of the judge's points, they don't hold a whole lot of water, and this starts to sound pretty politically motivated, right? If we go back to the original reasoning, like why did we have the mandate in the first place? What's the CDC trying to do? Do they want us to wear a mask forever? No. The reason we were doing this, again, was two reasons. One, we wanted to make sure that the healthcare systems didn't all get overloaded all at once by a huge surge of COVID patients. So we wanted to be careful to avoid that. And then more importantly, we wanted, if we could, to get to a point, not expose people until they had a chance to be vaccinated, right? At least those people who will agree to be vaccinated. And by now, we're at that point. You know, at this point, everyone who's willing to be vaccinated has been vaccinated, and even some of the people who haven't been vaccinated have had the disease and acquired immunity naturally that way. We've lost a lot of people, unfortunately, too. But the people that remain are total aggregate immunity, whether it be natural or vaccine, which is the much bigger pile. is up around 90% now. So we're in a good place for that mandate to go away. Is COVID going to go away? No, it's not going to go away. It's going to be around. It's going to be like the flu. It's going to be back every year. It's going to be seasonal. But having said that, will we see another big peak of cases next winter? I think we will. But what we won't see, at least I hope, and I feel pretty confident about, is we won't see anywhere near the peak of hospitalizations and deaths because the vaccines are really, really good at preventing serious disease and death. It doesn't make the risk zero, but it decreases it very, very markedly. It does decrease cases too, but not as much. So, yes, we'll have a surge in cases next winter, but we won't have near as many hospitalizations or deaths, or at least that's what the data points to. That's what I would predict. So, this is a good time for the mandate to go away. And thus, the verdict is not bad, but the way it came about is bad. Because remember, if this stands the way it is, that means the next time something horrible like syphilo-chlamydio monkeypox comes flying out of Asia, we're defenseless against it if the CDC does not have any power to do anything about it. And their power was derived from these acts, which Judge Mizell now said it doesn't have. So it's a problem if this stays in place that really limits the CDC's ability to help us, and that's a bad thing. So President Biden and a number of other people are taking action to try to at least amend this verdict, if not repeal it. And I think they'll probably be successful. Let's hope so. Otherwise, we could be in trouble the next time something like this comes around. And it will. It's just a matter of time. That's virology. That's how this stuff works. So hopefully that has made some sense. Hopefully that clears things up a little bit and you understand some of the reasoning underlying all of this. If that has helped you in any way, shape, or form, please hit the like button, consider subscribing, sharing with your friends. But regardless of whether you do that or not, it's been good having you. And remember, every day in some way, try to make the world a better place. Okay? I'll see you guys.